Good day, friends, and a warm welcome to episode 32 of the 4D show. Now, the 4D show means detailed discussion and dialogues for Indian diabetics. So, we'll be having a discussion today. We'll be in dialogue regarding the topic challenges in primary care for diabetes and hypertension. Now, diabetes and hypertension are so common, so prevalent that we need each and everyone on board to help us fight these pandemics. And we cannot work without the primary care system. Let's discuss, let's get in dialogue with our expert today. A warm welcome to Dr. Nitin Reddy. Warm welcome, Dr. Reddy.
Sir, good evening, sir.
Good evening. Dr. Reddy is consultant endocrinology at the prestigious AIG hospital in Hyderabad. He is an expert in diabetes endocrinology and his field of interest is young onset diabetes. I think a very apt choice for today because today across the country, younger and younger people are getting diabetes and hypertension. Dr. Nitin, would you like to present a few slides to set the ball rolling regarding this topic?
Yes, sir.
It's my proud privilege to be part of this seminar today, and I will be discussing about primary healthcare and the challenges for the diabetes as well as hypertension. So, I request to please share the slides on my behalf. Next slide, please. So, as we all know, diabetes as well as hypertension, these are the two major diseases which are connected to the lifestyle, and the numbers are on rise. As of now, India witnessed around 90 million people having diabetes, and the numbers are expected to rise because of the change in the lifestyle habits, easy availability of food, and also decreased mobility and the genetic predilection for the Asian phenotype, and the increase in the number of patients or number of people having diabetes. And the statistics according to the IDF, the Indian Diabetic Federation, India is next only to China amongst the most populous nation with people having diabetes. And the irony here is 53% of the people living in India doesn't know, or they're not aware of the fact that they have diabetes because of the asymptomatic nature of the disease. And 1 in 11 adults living in India have diabetes as of now. And the pre-diabetes, which is impaired glucose tolerance, 40 million people have impaired glucose tolerance, and they are at major risk of having type 2 diabetes mellitus in the near future. And in spite of increase in the healthcare sector as well as growing awareness, only one uh, out of three people living in India are having a good glycemic control. That means majority of them are still having uncontrolled diabetes. Next slide, please. So now the problem statement about hypertension. As we all know, hypertension is a culprit for future coronary events in the form of coronary artery disease as well as kidney, that is the chronic kidney failure, and also vision loss. So what are the major risk factors or culprits for the hypertension and the rise in the prevalence of hypertension? Of course, few are modifiable risk factors and few are non-modifiable risk factors. Example, age, which is a non-modifiable risk factor, and the other risk factors like alcohol, smoking, obesity, stress factor, and the poor lifestyle management as well as excess salt consumption and decreased mobility. They're all the modifiable risk factors for hypertension. And hypertension is also a leading cause for mortality in India. And as we see here in the statistics, that is the bar diagram, more and more people who are living in urbans are having hypertension in comparison to the people living in rurals. And when we see the final details, the people living in rural are having a poor control of hypertension. That is, though they take medicine for hypertension, because of decreased awareness and also because of the less accessibility for blood pressure monitoring, their blood pressure is relatively less controlled in comparison to the people living in urbans. Next slide, please. and the statistics are not any different between male as well as female, and there is no gender predilection for hypertension. And what is the reason for the inadequate control or poor adherence to the therapy, both to the hypertension as well as to the diabetes mellitus? The important factor here is because of the low general awareness about these lifestyle diseases and the complications that can happen if a person has either uncontrolled diabetes or hypertension. The complications can be in the form of microvascular diseases or macrovascular diseases, that is nephropathy, that is the kidney damage, retinopathy, neuropathy, that is nerve damage, and also the heart, brain, as well as the peripheral arterial disease. And the other reasons for the poor compliance as well as the inadequate control or the lack of uh, accessibility to the diagnosis as well as to the treatment, especially in people living in remote areas, and also the scarcity of the qualified healthcare professional and financial constraints in some people, and also the social barriers that there are people who uh, feel bad to take medicines if at all they are in their workplace, and these are all barriers which uh, are also the reason for the poor control of diabetes or hypertension. Next slide, please. And what is the evidence that we have in hand about the way we manage both diabetes as well as hypertension? There is this disparity between the public sector as well as the private sector management of these conditions. The major disparity being in public sector, we need to make sure we strengthen the capacity to make sure we make the guidelines available, and we should have to adhere to the guidelines so that there is some uniformity in the way a healthcare professional is going to manage a person with diabetes as well as hypertension. And when it comes to private sector, we need to have a communication and make sure we bring about a uniform guideline, maybe American association or maybe European association. There should be some communication, and then it's always good to make sure we follow a specific guideline when it comes to management of the people living in a society. Next slide, please. And the other challenges pertaining to the primary care challenges with respect to the hypertension as well as diabetes: the lack of communication between the primary healthcare professionals and patients, and the poor support for self-management, because patient is uh, should have to be made aware about not only the importance of good control, but also we should have to the give and we should have to explain about the future possibilities of the complications and the untoward consequences because of the complications. And we should have to always encourage them to monitor blood pressure as well as glucose values at home using the home glucometers or as well as sphygmomanometers. And because of the lack of resources such as the steady supply of medicines as well as laboratory supplies, and also doctor centered care process that impede the adequate counseling, because one must be able to, for example, any patient who is walking to the OPD with the diagnosis of young onset diabetes, it's always important to make sure we give good time to make sure um, uh, we encourage the patient about the good uh, adherence to the treatment, monitoring, and also timely follow-up. Next slide, please. So the strategies for diabetes patient who is having hypertension. Regular physical activity can lower blood pressure, and it also helps maintain the blood glucose values. The current CDC guideline recommend a minimum of 150 minutes of moderate intensity aerobic exercise each week, or at least 75 minutes of vigorous intensity exercise each week. So, what do we mean by moderate intensity exercise? This includes brisk walking as well as swimming, and people should also consider doing muscle strengthening exercises at least once or twice a week. And maintaining a healthy weight is also important for people with excess weight. Even loss of around couple of kilograms, that is around 5 to 6% of the weight, will be beneficial in an attempt to reduce the blood pressure as well as oral anti-diabetic medications. And the NHLBA, which is National Heart, Lung as well as Blood Institute, notes that around 3 to 5% loss of body weight can improve the blood pressure readings. Next slide, please. And the last but not the least, about the healthy diet as well as the lifestyle habits in the form of quitting smoking as well as alcohol. One should make sure we incorporate more and more of healthy fresh fruits and vegetables, and one should focus on high fiber diet, especially the whole grains, and we must emphasis on limiting the added salt as well as sugar. And it's always important to avoid the unhealthy fats, especially the trans fat and also the animal fat. All these healthy dietary habits not only helps with respect to the blood pressure as well as diabetes management, but also with respect to the cholesterol or dyslipidemia management. And smoking, as we all know, smoking makes sure will cause constriction of the blood vessels, and it will result in the temporary increase in the blood pressure, and subsequently buildup of plaque in the arteries, and it can lead to increase in the blood pressure over time, leading to consequences or complications in the form of coronary artery disease or cardiovascular accident, and also the risk factors in the form of chronic kidney disease. Retinopathy, which is the major cause for the blindness, is also a risk factor, is also a consequence of uh, smoking, and also peripheral neuropathy can be worsened because of smoking. So considering all these factors, it's always important to discuss not only about the medicines but also the importance of good lifestyle practices, might be diet or exercise, or with respect to the alcohol or smoking, uh, quitting smoking as well as alcohol. This is all important, and we should have to consider the patient as a whole. And then the final outcome is about making a person healthy with respect to the blood pressure, hypertension, or diabetes, and then cholesterol, and then achieving the normal ideal BMI is important. Next slide, please. So the treatment strategies for a diabetic person, as we all know these days, the the approaches are changing, have changed drastically since past 1 or 2 decades. Now the early initiation of combination therapy is of utmost importance. Be aggressive right from the beginning and make sure we do not delay the intensification of the therapy. And we should have to try and achieve the glycemic goals at the earliest. Because of the metabolic memory, the more is the delay in achieving the HbA1c target to 6.5, the more will be the chances of accumulation of the microvascular as well as the microvascular angiopathy. And at the same time, we should also have to give preference to preservation of the beta cell function, and there lies the importance of avoiding the sulfonylurea group of medicines at the earliest, and then the novel medicines which are available for the management of diabetes, especially in the form of DPP4 group of drugs, SGLT2 inhibitors or GLP-1 receptor agonists like sitagliptin, saxagliptin, and linagliptin, and vildagliptin for DPP4 inhibitors, canagliflozin, dapagliflozin, and empagliflozin for SGLT2 group of drugs, and liraglutide and dulaglutide for the GLP-1 group of drugs, and also semaglutide, which is the oral GLP-1 receptor agonist. And out of all these combinations, the early initiation of SGLT2 inhibitor and DPP4 group of drugs as a fixed dose combination is one of the suitable option for the Indian type 2 diabetes patients for these reasons, which I will be alluding in the next 1 or 2 minutes. This fixed dose combination will not only ensure the safety and the and rapid achievement of the target glycemic control, but it also improves the insulin resistance and also the beta cell function. It helps reduce body weight because of the SGLT2 component, and it also helps reduce the pill burden because of the combination therapy, and it improves adherence and compliance for the patient. And overall, it's also a cost-effective molecule. As we all know, the mechanism of action of SGLT2 and DPP4. SGLT2 predominantly acts via kidney. The DPP4 group predominantly acts via gut or the intestine, and the glucotoxicity is reduced via glucosuria because of the action of the SGLT2 group of drugs, and the GLP-1 as well as GIP are increased because of the incretin effect because of the DPP-4 group of drug. So all in all, the hyperglycemia is reduced, body weight is reduced marginally, systolic blood pressure is reduced, and also the beta cell preservation effect is also taken care.
Dr. Nitin, that was a wonderful presentation. Thank you for putting things in perspective for us. Thank you for putting forward all the challenges that we face. But let's talk about solutions as well. Before we move on to solutions, let's look at some of the reasons why diabetes and hypertension are so common in our country. Now, one question that is coming across is that there is such a high rate of malnutrition across the country. In fact, the National Family Health Survey 5 shows that about one third of all adults have low body weight. Why is it then that, in spite of this, diabetes and hypertension are so prevalent in India?
So thanks for the question, sir. In spite of malnutrition, the prevalence of diabetes as well as hypertension are on rise, and since last 1 decade, we have been witnessing more and more people having the diagnosis of young onset diabetes or hypertension and walking to the OPD. So this is predominantly because of the unique phenotype of Asian people, predominantly because of the abdominal adiposity that is less body proportion is the contribution is from the muscle, and predominantly the abdominal adiposity or adiposity of the human body in general is more in Asian people in comparison to the Caucasians. And apart from this, it's also because of the increased availability of food, especially the processed food, and increased sedentary lifestyle, as well as the change in behavior of people. There is this incidence of the prevalence of hypertension as well as diabetes is on rise.
You've spoken of processed food, and you've spoken of change in lifestyle. So, has westernization played any role in increasing the incidence of hypertension in India?
Yes, sir, certainly. So more and more of processed food, and because of the excess availability of salt, as well as the food consumption, which is predominantly saturated fat as well as trans fat. So all these change in the food habits is definitely bringing the change in the microvasculature as well, and because of excess accumulation of the lipids, and as well as the change in the microarchitecture and excess amount of plaque accumulation, the hypertension prevalence is on rise, and as well as the prevalence of hypertension and more complications of diabetes, especially young onset of diabetes, which is a more aggressive variant of diabetes, having more incidence of complications made by microangiopathy or macroangiopathy. The complications are on rise, and that's all to do with the insulin resistance as well as the unique phenotype of the Asian subcontinent population.
Uh, Dr. Nitin, you work in Hyderabad. You meet patients from across Telangana and even from the surrounding states. But let's speak from a Telangana perspective. What changes have taken place in our lifestyle? What changes have taken place on our dining table? Changes in choice of cereals and millets, in the way we cook food, and how have these impacted the incidence of diabetes and hypertension in the area?
Yes. So, especially since last 20 years, and particularly since last 10 years, because of in Telangana, especially because of more and more of uh, importance given to the IT sector, and immediately after 20 years of age, the moment people get graduated from the engineering college, they're getting placed, and then they're directly being recruited by the software companies. And because of the kind of work style or the lifestyle of the IT profession, they get to work for prolonged period of time in a sedentary state, and because of decreased mobility, and adding to this, there is stress factor as well, and that is why there is predominance of excess weight gain happening between 20 to 25 years or 30 years of age. And that is when the body composition or proportion changes have been taking place, and that is the reason why we witness more of young onset diabetes, especially in majority of the people who just go ahead with a casual health check which is sponsored by the company, and then to their surprise they are witnessing, they're seeing these sugar levels as well as dyslipidemia, and then fatty liver, uric acid, as well as the hypertension, to their surprise. And absolutely around majority of them, like 75 to 80% of them are asymptomatic, but still the parameters doesn't sound so good. That's because of the change in the lifestyle, as alluded previously, and also like how we usually suggest the routine diabetic plate should have around 50% of veggies as well as fruits, and then 25% of carbohydrate, and then the rest of the 25% should be protein as well as unsaturated fat. But unfortunately, because of as both wife and husband, they're both of them are from the software profession and busy lifestyle, they don't, probably sometime majority of the couple don't have time to cook the food themselves. They depend upon the processed food as well as the easily available food via online. And that is when if this happens for prolonged period of time, and more of defect keeps on accruing, and that is when the metabolic complications in the form of diabetes, hypertension, fatty liver are turning up in more preponderance in the last couple of years.
Any changes on the dining table, Dr. Reddy? What is it that our grandmothers used to cook, traditional Telangana staples, and what is it that we are eating now?
Yes, sir. So the whole grains which have fiber to it, and then in the last couple of years we are depending more upon the processed food, that is the, it's not whole grain, but the fiber component of the grains as well as cereals is lost. And the more fiber we introduce to the diet, and the less are the chances of having a dense carbohydrate meal. And I personally feel that this is the major change. And also fruits used to be part of every dining table or every meal in the days gone by, and now fruits are hardly being consumed as a daily meal.
Uh, in your practice now, you see people with diabetes, see people with hypertension. So, just a rough ballpark figure, out of all people with diabetes, roughly what percentage will have high blood pressure?
Yes. Roughly around 15 to 25% of the people have high blood pressure. That varies from age. If at all it's a young onset diabetic person, the probability of having hypertension is only to the tune of 5 to 10%. If at all it's around 45 to 55 years aged person who's having diabetes, then the probability of having hypertension is close to the tune of 20 to 35%. So it also depends upon the change in the blood vessels happening because of the age, as well as of course insulin resistance as well as diabetes will also play a part. But with as an add-on factor in the form of age, then the probability of having hypertension is more in people having diabetes for prolonged period of time, like 10 or 15 years down the line.
So the chances of having hypertension in a person with diabetes are more. Dr. Reddy, what about treatment? Would we prescribe the same treatment to, let us say, a 45-year-old gentleman with diabetes and without diabetes if they have high BP? And will the response be the same? Or will the person with diabetes need a greater number of drugs or a higher dose?
Yes, sir. So in a person who has diabetes, uh, upon good upon achieving the good glycemic control of the target HbA1c, there will be subtle improvement in the hypertension as well. But that doesn't mean we are going to stop the medicines altogether. But we usually, it should be a practice that we are going to monitor for the blood pressure at each and every time the patient is at the OPD. And also on top of that, like how we explain and make sure that we improve, we create the awareness about monitoring the blood sugar levels by checking it either on glucometer or CGMS at home. In a similar fashion, we ask a person to also monitor the blood pressure at home to just to see if at all the values are in place, or because as we know, both diabetes as well as hypertension, they are asymptomatic in majority of the people, especially in the initial few stages of the onset of, diabetes or hypertension. So similarly, the ARBs, that is angiotensin receptor blockers or AC inhibitors, are the drug of choice with respect to the management of hypertension in a person who has diabetes. But the guidelines do not deviate uh, much in a person who has no diabetes but only hypertension. Still, ARBs as well as ACE inhibitors are one of the drug agent of choice. But relatively, a person who has diabetes will respond promptly to either a single agent or a dual agent, and achieving the glycemic target is important. In a person who doesn't have diabetes, only hypertension, so probably an additional agent or an additional molecule may be required because the pathology is something else in a person who only has hypertension.
Another question coming up for you, Dr. Nitin. Is there any difference between men and women, or between urban and rural dwellers in terms of prevalence of hypertension?
Yes. So prevalence of hypertension, there is no significant difference to the best of my knowledge, but uh, the prevalence of hypertension is relatively more in people living in urban in comparison to the rural. But the crux here is uh, all those patients who are started on therapy because of the relatively more awareness about the control and the complications that can be anticipated in case a person has poor control. The urban people control for diabetes for hypertension once the treatment is initiated is relatively better in comparison to the control of hypertension in people who are from the rural background. And and answering the other question, sir, the prevalence of hypertension between the gender, that is male as well as female, uh, till the time there is menopause, that is around 50 years of age, there is no major difference in the hypertension prevalence. But as male gender being a relatively more aggressive gender, the probability of having more impact of the component of stress will also add to the male gender. But these days when we see more and more of female population also equally equally, they are also the breadwinners these days. Post menopause, that is after 50 years of age, because of the abrupt down of estrogen from the system in females, the change happens both at the level of hormones and also biochemically, and the cholesterol parameters go for it go are changed drastically and significantly. But in contrary, in males, the testosterone value, there is a gradual decline in the testosterone hormone over a period of 65 to 70 years. And that is the reason why the probability of having metabolic complications, may be diabetes or hypertension or fatty liver, is relatively more in postmenopausal females, that is after 50 years, in comparison to the 50 years aged male person.
You've spoken about these challenges, and what we understand is that both men and women, people living in villages and those in cities, they need to take care of themselves. Now, this concept of self-management, self-care is well ingrained in diabetes practice. What is it that the person living with hypertension needs to do to take care of himself or herself? What can the person do himself or herself to have better blood pressure control?
Yes. So the latest guidelines as well, the ADA guidelines, they emphasize more on the self management of diabetes, because it's the individual who should be made aware about the diagnosis of diabetes, about the treatment, as well as about the complication that can be anticipated, and about the target values that needs to be achieved. And that is where the importance of the initial consultation for the patient, the initial interaction between the healthcare provider and the person who is in the picture, the patient. The initial consultation is of great paramount importance, because there, uh, if at all a person is very well convinced about the fact that though a person is asymptomatic, there is a situation, there is a condition of hypertension or diabetes, and upon maintaining a good control of these parameters, he or she can make sure the probability or the chances of having complications in future can be minimized. Similarly, in hypertension as well, the importance of change in the necessary lifestyle behavior, that is stress management, and making sure that the compliance to the diabetes medicines, to the hypertension medicines is appropriate, and also cutting down the salt consumption or salt intake to less than 2 gram per day, and also try to avoid the excess food which has rich salt to it, that is a pickles, and making sure that he or she should have to at least keep a blood pressure apparatus, or making sure that he or she reaches to the nearest clinic or to the community health center, and then making a right call to check the blood pressure at least once in every 15 days or once in every month, to see if the values are well within the range, and if not so, then try to reach out to the nearest doctor for the right change in the medicines. This awareness about the monitoring is pretty very important.
Let's try to structure this for all people living with diabetes. What is it, or for all those living with hypertension, what is it that you can do? What is it that the primary care physician can advise you to do? First is sensible sustenance. Eat well. Don't be malnourished. Don't be hungry. Do not go on a restricted diet like keto diet or long term fasting, but sensible sustenance. Along with that would be salt restriction, like Dr. Nitin said, reduce salt. From an Indian perspective, three P's, which are very high in salt: pickle, that's pickles, pakoda, and papad. And a fourth P would be pizza. In fact, I am reminded, Dr. Nitin, of one of my favorite foods in Hyderabad, which is the gunpowder pickle. How much salt does that have?
And that has got high salt. Yes,
Lots of
yes.
salt and lots of saturated fat as well. Both of them should be avoided. So, sensible sustenance where you are reducing salt and where you are reducing saturated fat also. The second S would be a structured physical activity regimen. Now, both aerobics and resistance exercises are important. Resistance exercise is important because you want to maintain muscle mass, you want to avoid sarcopenia. But from a blood pressure lowering point of view, it is aerobics which will be better. The third S, Dr. Nitin spoke about that, would be stress management. And to that, perhaps we can add stress management, sleep hygiene, and avoiding substance abuse. And the last S, which again Dr. Nitin, he emphasized, that is a structured monitoring of blood pressure. Make sure that you have a system in place, systematic blood pressure monitoring, which you can do at home, you can do with a doctor, you can do both ways also. So if we are able to do this self-care, a few S's that we remember, then certainly blood pressure control will be better. And I think our colleagues in primary care, they shoulder the major burden of this. The the vast majority of people with high blood pressure and diabetes are taken care of by our colleagues in primary care. So thanks for doing that for all of us. I think, Dr. Nitin, would you join me? A salute to all the primary care physicians of India. A lot of hard work being done on the ground.
Definitely, sir. Definitely, yes. And
Now,
thanks
yeah,
for the I have learned a lot of things out of interacting with you. So thank you very much.
thank you. There are a few more questions, and uh, we use drugs for diabetes and hypertension. For diabetes, we know that we have to follow lifestyle and diet. Should we have the same emphasis on diet for people with hypertension, or do we don't need to bother about it at all, about the diet part in hypertension?
Yes, sir. Diet is important not only for diabetes, sir. It's also important for each and every metabolic condition, made by diabetes or hypertension or fatty liver or uric acid. So, as alluded previously, if at all one makes sure that the diet is appropriate, then we can definitely cut down on the number of antihypertension agents from 3 to 2 or from 2 to 1. So that way, it's about the right medicine at the right time. It's about the diet as well as physical activity and the stress management. All put together will be able to achieve the right target blood pressure.
Dr. Nitin, it's been great interacting with you. Thank you for all your insights. Uh,
My
Before we
pleasure, sir.
conclude, this is 4D. We are in discussion and dialogue with all the doctors who are managing Indian diabetics. So, what take home message would you have for everyone?
Yes. So, as we see more and more of young onset metabolic conditions, and just because of the fact that this is asymptomatic, we tend to give it a pass in the initial stages. Especially, we only tend to realize the importance of these conditions once a person has any complication because of it, may it be neuropathy or nephropathy or retinopathy. So, instead of taking the challenge, taking the complications, it's always prudent enough to make sure we diagnose or recognize these conditions in the early stages, and then take the right call and try to intensify the treatment at the right time, so that we can have the future without any compromise, and the quality of life shouldn't be compromised for future. So the management of metabolic conditions is always not for today or tomorrow, but it's for the right future and for the healthy future.
Thank you, Dr. Nitin. So, today, in this 30-second episode of 4D Show, we began by speaking about challenges in primary care. But now we've ended up with solutions, suggestions for how primary care can actually manage diabetes and hypertension. And like Dr. Nitin said, not only for today or tomorrow, even for day after tomorrow, for 10, 20, 30 years from now, for better individual health, better societal health, and for better national health. So the onus is on us, the responsibility is ours, and we just have to get together to fulfill it. I'd like to thank everyone for having been part of the 4D show. Sincere thanks to Dr. Reddy for taking time out. This is Ramzan month beginning today. This is Navratri going on. Thank you, Dr. Nitin, for sparing time on this new year, on this auspicious day for us. And I'd like to invite you again to the next episode of the 4D show. Together, we'll make a difference to India's health. Jai Hind, Dr. Nitin.
Jai Hind, sir. Thank you.